Nearly every day, we report on gun violence affecting our communities, and research shows people who survive one shooting face a higher risk of being shot again. But what if there were a way to stop that cycle?
Doctors say a program aimed at doing just that is getting real results. CBS 17's Maggie Newland getting answers about the impact of hospital-based violence intervention. Maggie.
Russ and Liz, gun violence takes a toll that is physical, emotional, and financial. According to a report by the U.S. Government Accountability Office, the initial hospital costs for gunshot wounds added up to more than $1 billion a year across the country, and that doesn't take into account long-term treatment many people will need. While hospital-based intervention programs may not stop gun violence before it happens, they may stop it from happening again and again. Flashing lights and crime tape, something no neighborhood wants to see. But for some, it can be hard to escape the sound of gunfire and the wail of sirens. Every year, Duke University Hospital treats hundreds of shooting victims.
Last year was 393.
Some come from across the state, but many are shot right on the streets of Durham. While medical teams work to save their lives, some also see a different kind of specialist.
To just let them understand and know that somebody's here to care.
Demetrius Lynn and Keith Patterson are senior violence recovery specialists. They link shooting survivors to resources in the community, everything from counseling to food assistance to job training, with the goal of making sure they don't end up back in the hospital.
What do they need to feel healthy and safe and stable? And so that's what we try to meet.
That means healing the injuries that aren't physical.
Depression, PTSD.
Demetrius knows the emotional trauma bullets leave behind.
I was shot in my neck at the age of 20 years old.
An athlete suddenly left without the use of his legs.
I didn't understand why I was paralyzed. I couldn't fathom why this happened to me.
Keith also feels the pain of gun violence, but from a different perspective. A shooting left his cousin paralyzed.
I do have an understanding from a caregiver point of view.
Now both work to show survivors and their families that their lives can be full and rewarding.
Some people just need somebody to listen. You've been through so much. You have people that come through here that are victims of multiple incidents, being shot before, been shot in the past.
Generally, people who have been victims of gun violence once have a higher risk of being a victim of gun violence a second time.
Uzuri Holder, the manager of the Duke Violence Recovery Program, says reducing the risk of being shot again is one goal of hospital-based violence intervention.
How can we support them as a whole so that they can go back and recover and really begin to live their life?
Does that help cut down on future acts of violence?
That's the hope.
Duke's program is less than 6 months old, but it's modeled after a program in Richmond, Virginia, created more than 15 years ago. Dr. Michael Abutanos is the director of VCU Health's Injury and Violence Prevention Program. He's also a trauma surgeon who knows the heartbreak of treating victims of repeated shootings.
I watched this kid die in the operating room, and I said, you know what, we're just a Band-Aid. We're treating to treat, only to treat again. And this is what started our program.
He says hospitals are uniquely positioned to reach victims of violence.
If you trust me enough to take care of your body, to help you walk, to help you heal, would you trust me to put you in a program that will help you not be in this situation again?
How do you measure the success of a program like this?
There are various ways of measuring. The first one is obviously the re-injury. Was this patient re-injured or not?
Dr. Abutanos says people who participate in the program at VCU rarely end up back in the hospital with a violence-related injury.
In our hospital, if you're not in our program, it's around 20%. If you are in our program, we're able to reduce it to 3.6%, which is huge.
The team at Duke hopes for similar success.
If it has to do with connecting to child care, we try to help them do that. Job or vocation training will connect them to resources in the community because Durham has a lot of programs.
Duke offers up to a year of follow-up support to patients who live in Durham, the city that both Demetrius and Keith call home.
When you hire people from the community who know the community, you have a better success rate.
Participation in the program is completely voluntary, and while it's still very new, the team says there are promising signs.
The patients are following up with their appointments. So I guess that's a start for success, you know, just putting the first foot forward.
And when it comes to healing, a little understanding can go a long way.
What's the most important thing that you think you can do for someone who's been shot?
make them feel human. It's as simple as that.
Duke's program is funded with a federal grant and by the hospital. In order to renew the grant, the program must prove it is effective. So far, Duke's program has worked with 60 patients. Wake Med also plans to start a hospital-based violence intervention program this summer. Rosin Liss.